West Marion Incorporated is the first and only Black-led nonprofit in McDowell County, and we make shift happen. We started back in 2016. It was an initiative with KB Reynolds Healthy Places, North Carolina, and the McDowell County Health Coalition had built environment pods, which was groups that went out and tried to talk to the community and see about what they wanted. So the first suggestion, they said, well, how about going to West Marion? And they were like, well, those people over there don't want nothing different. But Mary Snow, the consultant at the time, said, well, let's just give it a try. So from that process, she met with local leaders, and the whole process was inviting people in to have a conversation. So the first official forum started in April 2016. And I came, I think, around June of that same year. And the biggest thing from that meeting that still sparks my interest today is, what is your vision for your community? And when I heard that, I thought, do we have a choice, first of all, was the biggest question. And then it was like, so people in this room, I'm like, do you hear what they're saying? We have a choice. We can do something. I'm like looking around them. Do you hear what she's saying? And you know, I think just the key was saying, here's our community. We can have a choice of what happens in our community. And that's sprung everything and still springs, so as you can tell.
I was introduced to the leadership of West Marion when we received a grant from the Kate P. Reynolds Charitable Trust to work within the community to identify the social determinants of health. And so we reached out to traditional leadership and non-traditional leaders within the West Marion community to identify who the community was and who we needed to be talking to determine from the community what some of the challenges were, what the barriers were to physical, mental, emotional health and well-being. My involvement with establishing the West Marion Community Forum is, we held a series of meetings with the community to identify needs, and then we began to establish a more organized structure that was rooted in community. And then the City of Marion came alongside and partnered. Before West Marion Community Forum was a nonprofit, the City of Marion supported a grant application that allowed them to work within the community and grow. That's sort of the origin story, because we received funding which allowed them to do the great work that they're doing today and allowed them to grow and birth into a nonprofit organization and stand on their own.
When the group formed, it formed under the name West Marion Community Forum Incorporated, and I did their legal paperwork for them to do that because I believed in what they were doing, trying to bring cohesion, compassion, awareness, education, not only to the African American community, but to the entire McDowell County community. That was one of the things I liked the most, was the organizational objectives of this group to enhance the lives and health of everybody. So I signed on as a supporter early because their goals matched my goals of trying to help people who historically were underserved.
I started this work in 2016 as a consultant connected to the KB Reynolds Charitable Trust and the Healthy Places initiative that they had started in Western North Carolina. And my role was to support funders to think about how they could engage communities in authentic and genuine ways and really put people who are most impacted by health disparities front and center in building solutions. And so I came to the table to co-design the community forum process and model that we used to create the brave spaces that allow people to share their truths and share their stories and start to advocate for the changes that they want to see and really look deeper at the root issues that are holding their community back, from affordable housing to lack of transportation to food insecurity to health disparities, and how systems could respond to those changes instead of constantly asking people to change. And so it was an initiative that I truly believed in, and I still believe in, and it's kept me working alongside this amazing network of leaders for 8 years.
Our philosophy has always been to build relationships as deeply as we can, as earnestly as we can, and with sensitivity to understanding that people come with different lived experiences, different histories, and acknowledging those and building upon those in a very community-centered manner. And so even going to government meetings, and historically in McDowell County, people did not attend city council meetings, our county commissioner meetings, our board of aldermen meetings in Alford, and we turned that around, and we now have people that show up at those meetings and make their voices heard and speak during the public comment. And there's multiple examples where community has come together to actually influence policy here locally.
So the focus of today's Racial Equity Collaborative meeting is, we have two actually. One of our ongoing overall arching goals is declaring racism a public health crisis. So we wanted to debrief about Hurricane Helene because that disaster has come through.
Now, the latest on the aftermath of Hurricane Helene and the desperate search for people still missing. The death toll climbing to at least 166 people across the Southeast.
But we begin tonight with the spiraling emergency after Hurricane Helene, the mounting death toll, at least 182 lives lost, hundreds still unaccounted for.
My first interaction with West Marion and the community forums was on a more personal level. I was really able to see what was happening at the grassroots level to let community members be completely engaged in addressing the issues in their community and coming up with their own solutions. The beauty of the relationship that we've had with the community forums over the years is that they've also embedded in our emergency preparedness sector. So we meet quarterly, and we say, you know, we prepare on sunny days for the rainy days. And so they're well informed, they're embedded in our local emergency planning committees. They come do drills with us, and so they're able to embed with us immediately in disasters. And so when this disaster took place in late September, Ginger, Donna, and Paula were some of my first calls because I knew that they've already been embedded with us. They can be in our emergency operations center to assist us, but also to really give us a lens into these communities that may be isolated or underserved, to help us understand what needs to happen there to support them. And they've continued throughout. They helped with answering phones in our call center. They volunteered with logistics to deliver commodities. And since then, they've really been a really great partner in helping us understand some of these communities and how we can better assist them. Because a lot of communities aren't necessarily going to approach us for the assistance that's available. We have to be proactive and do outreach.
When we had Hurricane Helene, the worst hurricane ever to hit Western North Carolina, came on the 27th of September. There have been people who've been devastated because the hurricane blew down so many trees, caused flooding in so many areas. In a town of Old Fort, it's only about 10, 12 miles west of here, there was a family who went to the Hardee's fast food restaurant when it started raining. What had been just a street suddenly became filled with water so incredibly fast that it was knocking things over. And this family, sitting in Hardee's or standing at the window, they saw their mobile home get washed away and washed down the road in front of them. Now you talk about horror. I can't think of anything more horrible than for the mama and her 3 children to see their home go floating down, or not floating, rushing down at a violent rage of water, and that soon they had to be rescued by boat just to get out of Hardee's, and their home was gone.
I think the biggest thing for our community is they wasn't getting the resources connected to our community. So we're a resource connected too. So we have relationships with a lot of institutional partners. You know, we basically on speed dial with the emergency management system. So we were able to they were able to reach out and said, hey, our people are tired. They've been working 36 hours straight. Can y'all come and just answer the phone, you know, and as we try to locate people in the county.
Post Hurricane Helene, right, that has just devastated our region. And in the face of that devastation, we have seen so many people come and support their neighbors and make sure people have healthy food and make sure people have access to medicine and make sure people have housing and make sure they're not cold and make sure they have childcare. And like, that's what a healthy community looks like to me, is that we're all showing up for each other in non-judgmental, beautiful ways that isn't rooted in capitalism or rooted in power hoarding, but is rooted in solidarity for your neighbors and your community because you want everyone to thrive.
For me, success would be that we would have language justice for one, because we have a larger Hispanic population. And it's hard for those folks to navigate the system when people do not speak the language that you speak.
The strategy that we implemented for our health equity town halls were 4. So the very first one was the fishbowl, where we had providers and community come together and sit at the table and really discuss some hard questions about the healthcare system, its strengths, its challenges. And then from there, one of the largest things that came out of it was the language justice piece, where we decided to have our sign-in table completely in a different language, in Spanish. And so people that were coming in had to figure out how to sign in, and there was no interpretation similar to what somebody would experience in a healthcare system, whether it was a hospital or clinic. And then that took us to the third one, where we wanted to see the challenges that providers face in the day-to-day life in the healthcare system, because we know that they also struggle with some of the challenges. So we were able to get 4 to 5 providers to come in, and we had a panel and people were able to ask questions as well and learn a little bit about what it's like to work in the healthcare system. One of the largest things we have going on right now is our health equity toolkit. And so we've partnered with UNC Blue Ridge, one of 2 doctors there, to implement a toolkit that is bilingual and can be used in Spanish and English for the patients.
I've had several experiences with West Marion, but the most memorable and certainly the most impactful for me have been the forums that we held on healthcare and how it has impacted some of the different communities and the perception of healthcare in some of the different communities. We had at least 3 meetings about that, where there was good interaction with members from the community who have had experiences with the healthcare system, not only with the one I work in, but also other ones in the community. And it was very helpful to hear the perception and the perspectives of those who had had interactions, what the good things were about those interactions, but also the negative things, the things that were not perceived perhaps as we thought they would. We're a lot more aware of the problems that are encountered, I think, than what we were previously prior to that feedback. We're certainly much more aware of the history that dates back long before any interaction I'd ever had with anyone, but being aware of events that happened 70, 80 years ago in other parts of the country that still have lasting impact, lasting impressions that affect the way that people interact with the healthcare system. Health equity to me means equal access, that everybody has access to care, that everybody has the opportunity to expect the same excellent outcome that anyone has, regardless of race, gender, anything, that everybody has access to that, right?
Back during COVID, there was the number in Hispanics rising, and there was a fear in the language barrier. So we had that connection with our local EMS, and they're like, we need someone that the community can trust and they're bilingual. And Paula thought Kathy could come on, and Kathy was out there gearing up and helping people test, making phone calls, letting them know, you need to quarantine, or your family needs to quarantine. And then they saw more numbers, so then that's me and Kathy thought about me, and I came along with her, and we were out there gearing up, helping people test, making sure even just last names were matching up, because the Hispanic last name, sometimes they would to shorten it up, they would just put one last name instead of two. So when they were trying to find these people, they weren't able to find them no more because they only did one name or abbreviated last names. So I think that was one of the most positive things I've been able to see.
September 16th, 2023 at 1:46 p.m. I'm meeting with my program officer, Jason Bazin, and Stephanie Twitty of Eagle Market Street. And I was like, what is the mayor calling me for? So I took the call, and those were the words he said. Write this down, September 16th at 1:46 p.m. The building, the Old Black School, Mountain View, Hutchins High, they want to donate it to your organization. Wow, is all I could say. And having our program officer, Jason Bazin, there with me, who's been on this journey with us. He was in tears, I was crying. I was like, I cannot believe this, that we're gonna have this building that our parents went to, our ancestors were instrumental in building this building.
One of the best projects that we're working on today is the West Marion Resiliency Hub. We have an application in with the US EPA to revitalize a historic school in the West Marion community to serve as a community center, and it offers a lot of different services that the West Marion Community Forum is already doing, but this gives them a physical space where they can do their outreach work. The city of Marion came alongside them. We rezoned the property. It had been zoned to industrial many years ago after it was acquired, brought by a furniture company. And so we've worked alongside West Marion Community Forum to rezone the property back to office and institutional use to allow them to do the good work that they're doing.
The future of this building is going to impact McDowell County in a way. It's going to bring our youth of color out more. It's going to give them a space where they feel welcome and accepted, and where they're allowed to dream, and to where their vision for their future is able to be brought to light.
My hopes are that this building will bring the community just pure joy, happiness, and togetherness. I think that's something that we've been missing for quite a while, just bringing all the people into our space here in the Black community and like letting them see our greatness and just transcending in something that's never been seen before in this community. And just because we are a small town, that doesn't mean that we don't have big dreams.
We are servants. We are not here to receive. We are here to serve, and that's what I tried to get across to my team. It ain't about you, boo. Don't quit taking it personal. We just have to always say, it's a bigger picture. We're always looking at the bigger picture. And there's no I in team, as they say. I am the executive director, but I have a whole team not behind me, beside me. Not always sitting in the comfortable spaces where people come to us. We have to go out to other communities too and just start speaking our truth so they can understand the difference and how much we're alike.